I had a partial denture before, and over the years, the teeth that it was attached to started to wear away. We got to the point where you can't build those teeth up anymore. So I discussed having implants for the 2 teeth originally that were on the partial plate. And then we decided that the teeth were actually probably better to take them all out because we were just fixing teeth all the time and put a full top implant in. The denture, it was really a well-made denture, don't get me wrong. In the beginning, it was excellent. It fitted really well. But then after a while, the teeth that it was attached to started to wear away. So then it started to move a bit, trying to sometimes have to eat on one side if the wire was broken on the other, or smiling at people or talking with your mouth open too much. I was always conscious that, it could fall down, or you've got to clean it all the time. You've got to take it out after a meal, and you've got to clean, any food that's in it. It just got to the point where I thought, I really don't want to be doing this for the rest of my life. I thought about it and I thought, well, if I'm going to spend this amount of money on a couple of teeth at the front and then the rest start falling apart, it's cheaper to buy the whole lot than to have 1 or 2 put in, at different times. So that's where we made that decision. We discussed it and I decided to do the all-on 4, but with 6 implants. The fact that it's quite an expensive thing at first, and a lot of people are put off by that because they don't, honestly, a lot of people don't have that money up front, but there are ways that you can use your super. And when I realised that, and it's worthwhile because in the long run, you actually will save money. There's no pain involved, like you don't feel anything. It's certain uncomfortable, but it's the same as sitting in a dental chair when you're having something done. There may be no pain. You might feel a bit uncomfortable because of, you've got to be on this side or back that way or this way. Same as having any dental or doctor thing, the healing was pretty good. I didn't have too much swelling. Just before that night, before going back the next day to get the temporary, you feel a bit weird because you've got like these pegs in your mouth and you feel a bit weird because you've got no teeth. So that was about it. So once the final bridge was put in, they just feel like your own teeth. They're in your mouth and they're just the same as I've got my own teeth on the bottom and implants on the top, so they don't feel any different. So that's what you want. And of course, if you had dentures, a full top set of dentures, they wouldn't look like this, I can tell you. They're not going to look like implants. They just don't. Because it gives you a bit more confidence. You don't have to worry about if you want to do a big smile, you can, or, if you want to eat what you want, you can. Now that I've had them, you always say this, I could have done this a lot sooner, but I didn't. But anyway, I'm glad I did because, I could have spent tens of thousands of dollars, continuing for the rest of my life where all my teeth were starting to break away. So yes, if someone is thinking of getting the same treatment done, I would say yes, and I already have told people to do it.